I would like to thank you, Cameron, for inviting me to be a part of this panel, which really has been quite amazing. Some really fantastic projects out there, and I'm really proud to be a part of speaking on a panel of this stature. I'd also like to thank you for coming out today and being a part of this festival, this very important festival on neglected diseases. So my work is with Sanofi Pasteur. I am working as a global communications head for the launch of the first vaccine against dengue. Now, if you had told me 20 years ago that I would be working for a pharmaceutical company, I would have told you you're crazy. At that time, working as a medical writer in the United States, I felt that the pharmaceutical company was in fact probably the enemy of global public health, certainly not a friend. That was my perspective then. And certainly at that time, I wanted to contribute to global public health, which is why I joined the Peace Corps in Madagascar and worked for 3 years, finishing my master's in public health in epidemiology. So, 20 years ago, there were also groups of scientists around the world who were looking at discovering and developing a vaccine against dengue. Some of those scientists were located at Sanofi Pasteur. So dengue, a little known at that time tropical disease, also known as breakbone fever, which describes the pain and debilitation that it brings to people, to many people who suffer from dengue. Dengue, as you may or may not know, is caused by 4 different types of viruses. Distinct virus types, which means that people can get sick not once, not twice, but 4 times with this fever. And in fact, the second time tends to be quite severe, and dengue can progress into a hemorrhagic fever and can lead to death, although not at the level of malaria, thankfully. So in those ensuing years, from 20 years ago to today, dengue actually started going on a geographic rampage, really, to become what the WHO defines as the world's fastest growing vector-borne disease today. It exists in over 120 countries, and it puts at risk almost half the world's population. Clearly, this is a global public health threat. But dengue is not on the radar in the United States of America. It is not on the radar in Europe. So it threatens half the world's population, and yet it really isn't a major public health threat in the developed parts of the world, which is usually the focus for pharmaceutical companies, especially for innovative vaccine development. So about 10 years ago, when Sanofi Pasteur had hit upon a viable candidate for a dengue vaccine, they made a very bold decision. They decided that they would introduce a novel model to bring this new vaccine to the places where it was needed most, to the low and middle income countries in Southeast Asia and in Latin America, where dengue really is an increasingly burden on economic and human life in these countries. These countries, which really are contribute greatly to our global economy, but these countries where there is a lot of instability, economic and political. Such a new model would require a number of firsts. It would require a regulatory approval strategy that had never really been tried before on this kind of scale. It would also require that a commitment into a clinical development program spanning 15 countries around the world, going to the countries, Brazil, the Philippines, Thailand, Malaysia, Indonesia, Mexico, where dengue is on the rampage and continues to be prone to outbreaks. Going into these countries, working with local health authorities, local governments, to build capacity, to build on expertise, because this is really where the dengue experts are. They're not in the United States. They're not in Europe. they are, but for the most part, those who've worked with managing this disease, working with the epidemiology of this disease, are really located in these countries, in these middle and low-income countries. So, what does this mean? For me, actually, in those ensuing 20 years, I had come to realize that the private sector, the pharmaceutical industry, actually is not an enemy of global public health. And in fact, I believe today that they are a critical partner in finding solutions for the diseases that are plaguing our world today. I also know that viruses and infectious diseases don't respect borders. And in an increasingly global world that we live in, with increased urbanization and the mobility of populations, we can no longer think that diseases with exotic names like Zika and Ebola and Dengue, and who knows where the next emerging infections, what they'll be called, that those are not going to be knocking on our doors. Now, saying this may sound a little, self-centered. Well, so why shouldn't they be important if they're still staying in Africa or still staying in the subtropical and tropical parts of the world? Well, of course they are. But in reality, a lot of what drives our innovation in the pharmaceutical industry, in the vaccine development industry, really are the public health problems that are top priority in the developed world. And this is what Sanofi Pasteur has been trying to change with the dengue vaccine project, to basically introduce a new model that can bring an innovative vaccine first to these countries where the populations are living at greatest risk in the world, and where a vaccine can have the biggest impact on disease burden, and also can help to reduce the spread of diseases like dengue and Zika and Ebola. And this is something that should be of global international interest and importance. It's going to take global, and if you excuse the term, global partnerships between private and public sector to get ahead of the emerging infections that continue to rise up and plague and really do cause economic and human suffering in many of these tropical and subtropical countries. So 2 years ago, I made the decision to join Sanofi Pasteur and be a part of this project, because I realized that pharmaceutical industry should play this role. Now, it's a bold move. It not only requires an innovative vaccine, but it also is going to require a lot of innovation in terms of partnerships, in terms of communication as well, and in terms of, in order for this to really be a model that is sustainable, not just for the pharmaceutical industry, which is a for-profit industry, but also sustainable for the countries which need to introduce successfully this vaccine. We all know that, and the founder of Sanofi Pasteur, Charles Mérieux, said that it's not vaccines that save lives, but it's vaccination. And it sounds, okay, obvious, but in fact, what does that mean? It means that we cannot do this alone. No one entity can introduce vaccines alone. You need community engagement, you need advocacy, you need political leadership, you need long-term commitment, which, by the way, is not something that politicians are great at. And so you really need to get the advocacy, the grassroots movement. You need to really be working on all fronts. And communication is not the least of those fronts. I would argue that it is arguably the greatest of those fronts. Now, a couple years ago, a very prescient reporter by the name of Andrew Jack at the Financial Times was covering the story at Sanofi Pasteur. And he actually described the project, the dengue vaccine introduction project, Sanofi Pasteur, as an attempt to square the circle of philanthropy and profit. I think this is a wonderful quote. Clearly, we can all see, whether you don't have to be a mathematician to know that squaring a circle is not going to be easy. It's not something that I, as part of Sanofi Pasteur, want to be doing alone. It's something that we really need to do in close collaboration with all of you, in close collaboration with the countries in which dengue continues to be a major public health threat. It's something that I'm actually very proud to be a part of. So with that, I would like to end with just a film that basically drives home a little bit more some of the more hidden burden of dengue in the world today.
Semualah tempahan yang datang, kemudian meeting, projek yang datang, semua saya tak dapat pergi, maka habislah.
Dia mengatakan telah mengalami kerugian hampir jutaan ringgit jugalah. Selama 14 hari itu kalau tak jalan memang
sudah pasti banyak mengubah hidup saya, terutamanya dari segi pendapatan.
Thank you. So that's just a teaser for the longer film, which is about 10 to 12 minutes, and really does give you some insight into the lingering effect of dengue. And you get to see it twice. No, thank you very much.